Jessica, today we're going to examine your nose and sinuses, and I just want to ask you a few questions first.
Okay.
Are you troubled by sinus infections or a lot of discomfort
No.
in your nose or head? Any trouble breathing?
No.
Problems with bloody noses?
No.
Okay. This is a very easy examination. The parts that we examine when we look at the nose are, we examine the sinuses, we examine your frontal sinuses, which would be here, and your maxillary sinuses, which would be here. Although you have sinuses, ethmoid and sphenoid sinuses across the bridge of your nose, you can't examine those.
Okay.
The other thing that we're going to examine is just your external nose, just what you see when you look in the mirror, and we're going to use the otoscope that we used it when we examined your ears. We're going to look at your internal nose so that I can just look at the mucous membranes and see how they are in your septum. Okay, so what the nose usually does is it is for smell, and we also will check your smell, your odor identification, close your eyes and have you smell something. And the other thing that we do with the nose, or the purpose of the nose, is to warm, cleanse, and humidify air, because if you just breathed in ice-cold air, your nares would kind of stick together. It would be very uncomfortable, or if air was very dry. So it also serves a purpose. Now, the first thing that we want to do when we look at your nose is you can just look straight ahead, and well, actually, I'll turn to the side so we can see. I just want to see the shape of your nose here, and the shape. You have a small little bump right here. Your nose is fine. The other thing we're looking at is the skin color. And your skin color blends very well with the face. Sometimes with certain systemic diseases, we know that there is a systemic disease going on by just looking at the coloration of the nose, and it doesn't blend well with the face. The other thing that I want to look at is just to tip your head back and to look at the symmetry of your nares. And the symmetry of your nares is good. We look at your septum, which separates the nares, and we'll examine those further a little bit later on.